One word, skin cancer is preventable mostly.
If I only had one word to describe it, I would say curable.
Skin cancer is an epidemic right now, and I'd also like to add that it's largely preventable.
Sunscreen is important for people of all ages. It's definitely important for people that are fair skinned, so redheads, blondes, and those that are very young that have thin, sensitive skin that's more prone to burning. In addition, you're much more likely to develop cumulative sun exposure from an early age, and so when you start young, you can prevent a lot of the damage that we see as dermatologists that people present with later in life.
We're here in South Georgia and North Florida, and the sun is a way of life for us. If you go outside, you're in it, and the things that you can do that will be helpful is that if you wear a hat, if you're going to be doing yard work outside, or if you're going to be going to the beach, if you wear a hat with a brim, it will shade your face, it will shade your ears, it will shade the top of your head if you're a little shy on hair, and that will help. If you will wear sun protective clothing, a shirt or a jacket, there are special sun protective clothing that you can buy, but if you don't have those, just wearing a regular lightweight shirt, anything to do to cut down the amount of ultraviolet light that gets through the fabric and gets onto your skin is helpful. And then sunscreen.
Tanning beds are very dangerous because their use has gone up quite dramatically, particularly in young women. We've seen an increased incidence of melanoma of over 800% in the past 40 years, diagnosed in women 18 to 35, and this increase has largely been attributed to tanning beds. Of course, everyone believes that tan skin is beautiful skin, so there's immense pressure on young girls to conform to that beauty ideal, and so tanning bed use is extremely common. Even a quarter of high school students now use them, so there are many states that have enacted laws to ban tanning for minors, which I think is a positive step. The FDA has recently considered changing the requirements on tanning beds and making them and letting us realize they're far more dangerous than we once realized. Tanning bed use gives a concentrated dose of radiation to skin, often that's not is exposed to the sun, like breasts, buttocks, and genitals, and there seems to be a dramatic increase in the rates of melanoma, basal cell cancer, and squamous cell cancer in people who have used tanning beds. Even using a tanning bed one time before the age of 35 seems to increase your risk for melanoma by 75%, and that is really scary.
Most skin cancers are treated with surgery, and it's usually an in-office procedure. You don't have to come to the hospital. It's local anesthetic. The skin cancer is removed. You get a couple of stitches. You come back in a week, you get your stitches out. Problem solved. Once the skin cancer is out and the pathologist has told you that the margins are clear, then you really don't have to worry about that one anymore. But you have to worry about, well, okay, now I know I can make a skin cancer and I've got enough sun damage somewhere on my body that this could happen to me, and it could happen to me again.
People should be screened for skin cancer, certainly when they have a family history of that. If they have a lot of moles, that seems to be an increased risk factor for the development of melanoma. I always ask people to look for things that are new, different, changing, something that doesn't heal, or for lack of a better term, if there's something that looks like the ugly duckling, then I think that they should have that checked out. It's always good to have a baseline exam, particularly when people have had a lot of sun exposure or if there's a history of tanning bed use, and we can then educate them at that time and tell them what to look for.